Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Tim Beckett, our Fire Chief and Director of Emergency Management, and as well, Megan Nichols, the CEO of the Mississauga Food Bank. Before I give my update, I want to send my best wishes to the Peel police officers and the Mississauga firefighters who were taken to hospital yesterday for smoke inhalation after responding to a fire in Malton. We are so grateful for the work you do to protect our community, and I'm wishing you all a speedy recovery. Last week, I asked residents to do the right thing and not the easy thing by keeping Thanksgiving gatherings to their immediate households and essential supports. I know that things probably looked very different around your Thanksgiving dinner table this year, but we managed to stay connected, although we were apart. From Zoom and FaceTime calls to delivering meals to aging family members, I want to thank everyone for making this sacrifice. At my house, things looked a little bit different as well. Certainly not our typical Thanksgiving, but I stayed busy cooking up a storm, including a delicious squash soup, and dropped off some turkey, dinner, and some soup to my mother, Veronica. Hi, Mom. She's always watching. I really hope our efforts will now pay off and ensure we can enjoy, once again, family time to celebrate Diwali, Christmas, Hanukkah, and Kwanzaa with our family and friends. Right now, Peel is averaging 152 new COVID-19 cases per day on average, and of those, 50 in Mississauga over the last week. Yes, this is slightly up from last week, and we haven't seen these kinds of numbers since early June, but the good news is that we've had far fewer people being admitted to hospital than we did during the first wave. Dr. Lowe assures me that while our cases are increasing, they remain steady and manageable at this time. But we know that if we aren't careful, this can change at any moment. It takes just one lapse to push cases out of control and back into the wider community. Only we can move this virus. If we stop moving, so does the virus. Last week, I asked you to shrink your bubble to just the essential people in your lives. And this week, I'm asking you to go one step further by eliminating all non-essential contact, which will drive down your risk and help us avoid a longer lockdown. A social lockdown, you might say, meaning no more dinner parties, no coffee with friends, and no unnecessary trips to the mall. I know how important it is to stay connected with friends and family, but please, take it online. I know many people, especially in our business community, were disappointed when the province announced that Peel Region, along with the City of Toronto and Ottawa, would be moved into a modified Stage 2 until November 7th. Many were wondering why businesses in Mississauga have to suffer when, unlike Toronto, that we aren't seeing transmission in those settings. The reality is that closing businesses in one jurisdiction has the potential to cause a spillover effect in neighbouring regions. If businesses are closed in Toronto and not in Peel, residents may travel here to visit our bars, restaurants, or gyms and cause our numbers to spike. The same could be said across the GTA, which is why I asked the Premier to extending these restrictions to other regions that border Peel and Toronto. I know just how hard this has been for our small business community, who have already sacrificed so much. Many who were preparing for what was meant to be a busy and profitable Thanksgiving weekend. But I can tell you that this decision was made by the province to best protect the health and safety of residents, not only in Mississauga, but across the GTA. As Mayor, I will continue to do everything in my power to support the business community. Last week, my conversations with the Prime Minister, I stressed the need for funding to support bars, restaurants, and banquet halls. Shortly thereafter, the federal government acted to introduce a range of supports from rent relief to wage subsidies and loans that will help small businesses retain jobs and stay afloat during this difficult time. I also want to thank the province for announcing $300 million in new relief measures for local restaurants and other businesses impacted by the new measures, which will help offset their fixed costs, such as property taxes, hydro, and natural gas bills. Locally, Council will be exploring another extension to our temporary patio program to keep patio season going year-round. We're doing what we can, where we can, to help our businesses weather this storm. We are asking that the residents do the same. Please rally behind our local businesses as we celebrate Small Business Month in October, as well as in the weeks and the months to come. At each and every opportunity, buy and shop Mississauga made. Small acts can go a long way with a local business, whether that is ordering takeout once a week or making a concerted effort to buy at least a cup of coffee every day from your local coffee shop. Residents should also be aware that the new provincial restrictions also affect some city-run programs, mainly in our recreation centres. For now, we have suspended all fitness and dance classes, team sports, weight room, and fitness centre use. Non-team sports such as badminton and pickleball, as well as aquatic, arts, and learning programs will continue to run at a limited capacity. More information can be found at Mississauga.ca. I know we're all tired of COVID-19 and desperately want things to return to normal. But life as we know it has changed, and we must learn to live with it and prevent its spread until a vaccine is readily available. It is my hope that these measures will make a big difference and will help keep our schools open, protect our long-term care facilities, and avoid larger and longer lockdown. These sacrifices must be made now so we can have a safe and full recovery of our economy. We will continue to closely monitor case numbers during this 28-day period to see if the restrictions are having an impact when it comes to case numbers and our hospital capacity. And of course, resources to expand testing and ensure that everyone who needs a test can get one. And to get their results quickly as well. If you need to be tested because you have been exposed and have symptoms, please visit Trillium Health Partners website to book an assessment for a test. If you do not have symptoms, but live or work in a high-risk setting or plan to visit a long-term care home or have been in contact with a confirmed positive case, please visit one of the 8 pharmacies across the city who are offering asymptomatic testing. I urge the province to continue to expand the number of pharmacies offering this program to ensure that they have the capacity to conduct more than the current 50 tests per day. I have sent a letter to Minister Elliott asking for more pharmacies, especially in the community of Malton, to ensure that everyone who needs a test can get one. I know that some of our residents are being put in an extremely tough situation by having to miss work or school as they wait to get a test and then wait again for the results. The last thing we want to see is people foregoing testing and possibly exposing their co-workers and peers to the virus. Today, Premier Ford announced additional contact tracing capacity for Toronto and Ottawa and an expansion of the pharmacy testing program to new areas across the province. I urge him to also consider the needs of hotspots like Peel Region when allocating additional resources. We need the support now to immediately increase our testing capacity and clear the current backlogs so that we can get healthy people back to work. I urge all residents to get their flu shot this year to take the pressure off our already overburdened hospitals. This is the responsible thing to do. To find out where you can get your flu shot, visit peelregion.ca/flu. Before I bring up Dr. Lowe, I want to talk a little bit about Halloween. as I've been getting more and more questions on whether or not it's proceeding this year. First and foremost, let me say, I don't want to see Halloween cancelled. I would like to see it going forward this year with some precautions put in place. This is one of the most exciting times of year for our kids, and I know that their little hearts would be broken if we couldn't find a way to make it work, although safely. Dr. Lowe is striking an internal Halloween task force and will consult and coordinate with other GTHA health units to develop a set of recommendations to help keep our trick-or-treaters safe. It is my hope that these recommendations will inform the province on a single, unified public message on how families across the province can safely enjoy Halloween. It is up to us to take lockdown seriously and push case numbers down as we approach Halloween. At the end of the day, it is up to parents to decide what's best for their children. And I know many are also talking about Halloween and how it can be done at home with indoor scavenger hunts or connecting with friends online. As always, I will be taking the lead from our public health professionals, and I will, of course, provide residents with an update as soon as I can. And now I will invite Dr. Lowe to provide us with his weekly update. Thank you. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 4,377 cases of COVID-19 in the city of Mississauga. Of these, 270 are active, 3,875 have resolved, and 232 have passed away. In July, I advocated for Peel to enter Stage 3 in recalling the primary goals of our pandemic response, being to save lives, protect our healthcare system, and minimize societal and economic impacts as much as possible. The initial closures and restrictions in the spring were to bring the disease under control. They allowed us to learn more about it, to stop its spread and treat it, to build up capacity to respond, and to adopt precautions in our community. At the time in July, prolonging closures would have had negative impacts on health and well-being, given that the disease had been brought under control. That's why in August, as we saw, an expected rise of cases with increased contacts occurred in our reopened community, and in September, our rates remained high but consistent, contained within households, social gatherings, and workplace clusters. Thankfully, while our case and numbers have stayed steady and high, hospitalizations in Mississauga, both on the ward and the ICU, have remained low and stable. And hopefully it stays that way. But COVID-19 does lurk everywhere. And during the past few months, you have heard me speak about how we need to learn to live with this disease. I've also been very clear that there's no secret to what we need to do to keep COVID down and our community open, and that the majority of our community has taken that advice to heart. So I know that the 28-day pause that was put in place recently may seem like a step backwards, but I can state with confidence that it isn't. We don't all agree on restrictions, but we all agree that stopping spread is job number one. And I think we understand and accept that applying significant restrictions in a neighboring city without introducing them here in Peel might have moved riskier behaviors into our bars, our restaurants, our gyms, and similar settings. I'm supportive and grateful that our Peel-specific recommendations around closing event centres and banquet halls and lower consistent social gathering limits were included in the new provincial restrictions. And I'm also glad that the province is providing financial support for businesses impacted by the changes as they again sacrifice to keep our community safe. So as we head into this 28-day pause, it's imperative that we remember, if we live as if COVID-19 does not exist, COVID-19 will quickly remind us that it is still here. We know what we need to do to live with COVID-19. We've learned this over the last 7 months. It is a virus that transmits from person to person, particularly in close contact, crowded places, and confined settings. It cannot transmit if human beings do not meet. So we must remember that less is more. Less in person, more virtual. Less people per gathering. Less proximity and distance, and more distance. Always assume that anybody you meet might be carrying the virus. Of course, that doesn't mean living in fear. It means taking precautions when you do meet to keep yourself and the people you love safe. So it's important to start by shrinking your close contacts to your immediate households and essential supports, such as caregivers or childcare providers that you rely on for daily assistance. These are the only people who you should be sharing a 2-meter bubble with. Otherwise, leave your house only for essential reasons: work, education, exercise and fitness, healthcare appointments, and accessing food, drink, gas, and automobile maintenance. And also to get your flu shot to take influenza out of the equation this season. For every other reason to meet, I encourage you to cancel, to postpone, or to go virtual. And if you do have to meet, keep numbers low and stick to the core 4 of distancing, masking, hand washing, and staying home if you feel sick. Doing this right, reducing our contacts, will drive down case numbers and will make contact tracing quicker and easier if an exposure does occur. It also means that hopefully, if we do this right, that this pause will not last longer than absolutely necessary. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. And we've given you a little brief update on our Halloween plans. Now I want to give you a quick update on one of the most important initiatives we have all year, and that is the Mayor's Thanksgiving Food Drive. Our goal this year was to raise $250,000 and 170,000 pounds of food by October 18th for the Mississauga Food Bank. I'm delighted to say that we have exceeded our financial goal of $250,000. Thank you, Mississauga, raising more than $377,000, but we still need one more push to get us over the final finish line to reach the 170,000 pound food mark. This is a huge accomplishment, and I thank everyone who has donated, especially during this challenging time when many were not in a position to give. This wouldn't have been possible without residents from every corner of the city pitching in, communities and businesses coming together, and even our local politicians, from councillors to MPPs and MPs and countless others who have stepped up and gave in a big way so that no one in our city went without Thanksgiving this year. And keeping with that spirit of giving, I want to acknowledge the many bars and restaurants who reached out over the weekend to ask how they could donate their fresh food in stock to ensure that it didn't go to waste. I want to thank them for this wonderful gesture. In the face of adversity, you are still giving back. You represent the true spirit of Mississauga. And now, I invite a very special guest speaker, Megan Nichols, the CEO of the Mississauga Food Bank, up to give us a brief update and hopefully encourage all of you to donate just a little bit more non-perishable foods. Megan, over to you.
Thank you, Mayor Crombie. I hope everyone had a happy Thanksgiving, whether you were able to spend time with your family, virtually, or perhaps around your table. Since the onset of the pandemic in March, the Food Bank has distributed food for 2.7 million meals to almost 26,000 people in Mississauga. Last year at this time, we had seen just shy of 16,000 people. So that's 10,000 more of our neighbors going to a food bank during the last 7 months, almost 6,000 of whom used the food bank for the first time. As Mayor Crombie just mentioned, to date, you have given $377,000 to the campaign. Thank you, Mississauga. We know household budgets are tight, but you've once again proven to be a generous and compassionate community. But we still have a ways to go to meet our food goal. So far, you've given 150,000 pounds of food during this year's campaign, compared to 266,000 last year. We set our goals conservatively this year, knowing there would be fewer physical food drives and more of a focus on online giving. But the reality is, we still need to get food into people's homes. There are more hungry people to feed, and we need even more food to make sure we keep up with the demand. There's still time to raise the amount of food needed by October 18th, though. The best way to do it is to make a financial donation. With your cash donation, we can source healthy and nutritious food at a quarter of the cost you pay at the grocery store and get it to our hungry neighbors as quickly as possible. Your gift will ensure our neighbors have access to healthy and nutritious food, including meat products, dairy, and even fresh fruit and vegetables. We know the coming months are going to be difficult for all of us. However, they'll be especially tough for our neighbors who are already struggling to make ends meet. That's why I'm asking today, if you haven't given yet, please donate to Mayor Crombie's Thanksgiving food drive before it ends on Sunday. You can visit us online at www.themississaugafoodbank.org/Thanksgiving or call us at 905-270-5589 to donate today to ensure no one goes hungry this fall or in the months to come. In the spirit of the season, I'd like to give a big thank you to Mayor Crombie for her ongoing commitment to the fight against hunger here in Mississauga, and of course to our friends, the Tim Hortons restaurant owners here in Mississauga, for sponsoring this year's campaign. I'll pass things back to Mayor Crombie.
Thank you, Megan. And now I'm happy to take questions from the media.
Mayor Crombie, your first question comes from Ashley Newport in Mississauga. Ashley, please go ahead.
Hi, Ashley.
Hi, Mayor Crombie.
Hi.
Hello.
Hello.
How are you?
I'm very good. How about you?
I'm doing well.
Hope you're staying healthy.
Yes. So obviously a lot of businesses are very distressed about this. We know that restaurants and bars in particular are really concerned because at least according to Peel's data, the new cases don't appear to be coming from bars and restaurants and gyms and whatnot. And I know that one big anxiety that a lot of people are feeling is that, you know, last time back in the spring, granted we knew less, a 2-week shutdown turned into 4 months. So I guess I'm wondering if in the event that this 28 days extends beyond that, if it turns into, you know, 2 months or 3, do you plan on perhaps, you know, talking to the province about maybe lifting restrictions, at least for Mississauga businesses, a bit earlier if this shutdown goes on longer than anticipated?
Yeah, it's an excellent question. And I do plan to monitor the case count numbers very, very closely, Ashley. And while we don't see transmission in those businesses, not in the restaurants, the bars, the lounges, the pubs, or the gyms in Mississauga, the issue is there is a spillover effect from the city of Toronto, and we have to be very careful. And we do want to, of course, ensure the health and safety and wellness of all our residents, but of course, right across the GTA and in Ontario as well. But we will be looking at the numbers, and we're looking at hospital admissions. We're looking at the rates in ICU, etc. We're looking carefully what happens in our long-term care facilities. We'll be looking at the whole picture, and if conditions continue to improve, as I'm very hopeful they will, well, I will certainly be asking the Premier to lift some of the restrictions. You know, certainly perhaps lift the restriction on indoor dining and in gyms and banquet halls, but maybe lower the capacity numbers. Whatever it might be, we'll be monitoring very closely. Dr. Lowe, I don't know if you want to add anything to that. He may want to add as well. I know that he also monitors all the indicators very, very closely. Dr. Lowe?
Yes, thank you, Madam Mayor, for the chance to respond. Thank you, Ashley, for the question. It's really an important question, and I do want to reinforce that while we did not yet see transmission in restaurants and gyms, in bars in the region of Peel, the picture is always evolving. We continue to keep a careful eye on that, and I think I understood and accepted that if the restrictions were applied differentially in Toronto versus in Peel, it's not only Toronto residents that be coming out to Peel, but we did have data that showed that Peel residents were eating out, dining out in places in Toronto. And so the concern being that if they may have been exposed in places in Toronto and then we're continuing the same activities here in Peel, with our high rates of transmission, while they are in known clusters, there is a concern that there may have been additional activity seen with the result of that shift of mobility from Toronto into Peel. So, you know, I know it's not necessarily an easy decision that was was taken. But I think the restrictions may have come in at just the right point for us here in Peel, that hopefully after the next 28 days, we can make a good case to see if we are continuing to have this under control and what might be done at that point. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Ashley.
Thank you. And then my follow-up question is, you mentioned a few minutes ago that you've also talked to the province about potentially expanding this modified stage 2 to other GTA cities. How did the Premier of the province respond to that? Do you think that that's something that they're carefully considering, or are the other regions going to be upset with you now based on this?
Ashley, so the GTHA mayors have a call on usually Mondays, but this week we had it on Tuesdays, so yesterday. And certainly the issue was raised that if spillover effect is the concern, that the areas Vaughan, Markham, Halton region should be concerned as well. So we will be watching the numbers there very closely. We all will, but certainly their public health units will be watching the numbers very closely to see if, in fact, that there is a spillover effect. And I'm quite certain that the Premier will be very quick to respond should that be the case.
Your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hey, Mayor Crombie.
Welcome. Thank you.
So today at Council, you heard a pretty powerful deputation about diversity and anti-Black racism in the city.
Yes.
And in the response, both you and staff basically said, you know, these things take time, and gave a list of some of the things you're doing behind the scenes.
We are, yes.
Given that some of the deputation, it was very specific, it had quite a specific list of kind of asks and demands. What stopped you going further and actually giving a concrete new commitment today, rather than simply saying all the things that you've done in the past?
Oh, well, no, actually, Isaac, thank you for the question. So we did reiterate the steps that we have taken, and then the actions we are still taking. There's much work to do. We take this very, very seriously, and a plan to address it head on. The woman who came forward today was extremely well briefed on the issues, and I invite her to participate on the panel. So I hope she does put her name forward. We could all benefit from the wealth of information and knowledge that she brings. No, we are moving forward with many of these items and actions. There have been some small delays with respect to, staffing in my office with resulted changeover of the stakeholder person and the survey not getting underway at the city level because of COVID. But things are moving, just perhaps not as quick as we would all like, but we are absolutely moving forward.
Perfect. My follow-up actually on 311.
Yes.
Last week, Mary Kent mentioned some of the holdups that have been with 311, how they've been quite overridden with calls recently. And I've looked at some of the data. 25% of all calls to 311 since April have been about COVID-19. Mm-hmm. And given the number of questions that you get, that Dr. Lowe gets, the bylaw enforcement elements, has there been any thought given to setting up a number similar to 311? I don't know, 411, 511.
Right. For COVID-related calls, for COVID-related calls, press 1, right? So certainly there is the option. No, we haven't done that as yet. We haven't got triaged them to that point. However, there is an opportunity to email in questions to myself, to Peel Region. There is a website at Peel Region, peelregion.ca/coronavirus. There's a wealth of information there as well. We have the same, Mississauga.ca/coronavirus. So there are mayor's office, mayor@Mississauga.ca. Feel free to email us, call Dr. Lowe at Peel Public Health, call the region, call us. The reality is many people have been working from home, and of course this is very top of mind for many people, so they have the opportunity and have many questions and have been calling in. As you know, the rate of calls that we've been receiving has been unprecedented, really, and it's largely related to the COVID issues. So no, we haven't done that quite yet. There are many opportunities and many different ways to communicate with the public, but certainly if things don't calm down, then that's something we could consider. Isaac, thank you for the suggestion.
The next question is for Dr. Lowe.
Thank you.
Great. Go ahead.
Dr. Lowe, you have Steve Cornwall from the Mississauga News. Steve, please go ahead.
Hi, Dr. Lowe. How are you?
Good, Steve. You?
I'm good, thanks.
Great.
Just a question around kind of what we might be looking at after 28 days of these closures. You said repeatedly, I think it was up again today, around how the the Peel situation, the cases are more tied to workplace exposures and then household kind of exposures stemming from that. So are you confident that closing bars and restaurants and other kind of indoor services in the city will actually lower cases in Peel 28 days from now?
I think it actually, going back to what I said in my remarks, it allows to ensure that those activities do not come over and add to our case count. And we do know that there are Peel residents who have been wining and dining in the city of Toronto and that have contracted the disease there. And we know that if Toronto closed and Peel stayed open, they would simply move those activities from, downtown Toronto to their local, their local strip mall or their local restaurant, wherever they might be eating out at. So I think that will help us, at least in terms of making sure that we're not seeing an uptick of cases associated with the shifting of activity into Peel. On the other pieces around workplaces, homes, certainly we have applied, as you know, to the federal government for an isolation facility and understand that a response is forthcoming soon, hopefully. And we also are continuing our discussion with the Ministry of Labour around more proactive workplace blitzes. With everything said, Steve, the most important thing for all of our residents in Peel to know at this point, the one thing they can do to help us bring case counts down over the next 28 days is to limit their in-person contacts. So shrinking their households as much as possible to immediate households and essential supports, people that they rely on daily for caregiving and otherwise. And for everyone else, whoever it is, making sure that they're only meeting for essential reasons, sticking to the precaution, and postponing, cancelling, or moving online anything else that they can do. Really, that's where the front line of this fight is at this point in time. Thanks for the question.
It's another question for you as well, Dr. Lowe.
Sorry.
We learned today that the province is adding additional contact tracers to Toronto and Ottawa. Can you first just tell us how many contact tracers Peel actually has at its disposal to use, and then secondly, will you be applying for more contact tracers for Peel specifically? Yeah, so we, at the height of our response, and as of the past long weekend where we brought a lot more people back in, we have about 200 staff that are working on contact tracing. That's almost about 10 times as many staff as we usually have working on these. And the province has reached out and offered us similar assistance to Toronto and Ottawa, and we are currently in discussion with them as to what that is going to look like for us at Peel Public Health. Thanks for the question.
Mayor Crombie, your final question comes from Khaled from My Second Home TV. Khaled, please go ahead.
Hi, Khaled.
With Halloween on the air, every year we have some yahoos who tamper with the candy for the kids. And that's, of course, this encourages lots of parents to let them live this great experience. I haven't seen any councillor, neither MP or MPP, calling for a bill to make this as a criminal act. What do you think about that?
Oh, so certainly if we could find the person and catch them, they would be charged. I think there have been charges in the past, Khaled, people who were caught putting, contaminating or putting, in the past razor blades or whatever it was into the candy of children. There have been charges in the past, of course. So I don't know that a bill is necessary. I will say it's difficult to track and trace the individual.
I see, yeah. Sorry about that, but anyhow, I have a follow-up for Dr. Lowe, if you
Certainly.
may. Thank you so much.
All right, Khaled, go ahead with your question.
Dr. Lowe, if you have a discussion with a young man, 20 years, 24 years, you say it's so difficult to convince them not to go to the gym right now, especially when they always question why our gyms are closed, when it is right now the cleanest place ever. Even you can take food that drops on the floor. From your perspective, as an expert, how would you deal with them, and what are you gonna tell them?
Khaled, it's a great question. And first of all, let me tell you, if you do drop food at the gym, I don't recommend that you eat it off the floor. That's the first place I would start. But it really is increasingly, the cleanliness of a place is becoming less and less a factor. I mean, certainly it is a very important factor, and it is important just to remind ourselves around the need to hand wash, the need to take the precautions seriously. But it's becoming increasingly clear from our data and from evidence that this is a disease that is spread from person to person. And most typically it's being spread in crowded or confined places where people aren't distancing, where it's difficult to mask. And that's another reason why we've started to see, at least in the city of Toronto, for example, restaurants and bars where people have to remove their masks in order to eat, and they may be in close contact with people who are not in their families, but also gyms, especially if, you might be in a class, they might cram a few extra latecomers into the class so you're not fully apart and you're not wearing masks, you're breathing heavily, droplets are flying around the room. That's essentially what happened, for example, in a recent outbreak, as you know, in Hamilton, Ontario, where a fitness center saw a significant spread. So I think that's why those settings are a little higher risk right now, because it's where people are, where they may be enclosed, confined spaces, where ventilation may not be all that great, where they may be spreading droplets between each other. And so for a 20 to 25-year-old person who is really trying to get their workout in, I say, now's a great time to invest in a pair of running shoes. Now is a great time to maybe go on YouTube and look up some fitness videos, some high-intensity training somewhere there, and do it on your own, at least for the 28 days, so you can stay healthy, but also keep our numbers down. So thanks very much for the question.
Thank you, Dr. Lowe. There are no further questions. This concludes today's press conference. On behalf of the mayor, I want to thank everyone for participating. Have a great day and stay well.
Thank you for joining us today.